Welcome once again to Parenting Dialogues. This is our November series. My name is Terry Shiundu. I am born again. I love Jesus. So as I said, this forum started in June and we've had various topics. And so I am truly blessed and honored to be discussing to be having a special guest, that is Nancy Ngetha, who is a counseling psychologist.
As she has said, I'm Nancy Ngetha, and I really feel privileged to be in this forum and doing what I love doing, what I like doing. Area of mental health, I think I've spent quite a number of years on this, and hands-on counselor. And when it comes to the topic of depression, suicide, schizophrenia, bipolar, I really, sometimes I may not even need the PowerPoint, but for the sake of time and guiding, I'm going to share some of the slides. My name is Nancy Ngetha, and I am a counseling psychologist with a background of nursing as a general nurse and also as an intensive care nurse, where I diverted to counseling and I became a counselor in the intensive care unit and also in the renal department. That is where we have the kidney issues, and at some point in the burns unit, until later I was put to work at the Kenyatta National Hospital, now another unit and reproductive health, but specifically at the youth center, where the youth center we have encountered quite a number of young people suffering depression, also suicidal attempts, and all that kind of thing. And of course, other health related issues going with the young people. When I listen to Terry and I hear at what age she was trying this, then I just see the youth center where I've worked I have been working for the last 11 years until recently, when I think I was reminded of my age, and I was to step out for a younger generation. I am a mother of 3 young adults, and I'm a grandmother of a teenager who is now 16, and another one is going 9 years. And so that's how young I am. I have been practicing as a nurse, as a counselor for quite a number of years at the Kenyatta Hospital. And also earlier on, before joining Kenyatta, I was with the Minister of Health, worked at the coast at Cliff Hospital, and then later on I worked in Thika, then joined the Kenyatta Hospital. I have consulted with different organizations, NGOs, religious institutions. I have done corporate social responsibility, and congratulations, Stelly, because I have done this corporate social responsibility when we got the cases of corona, and I started off in April 24th. Until recently, I put on hold, and I've held 3 or 4 meetings every week, focusing mainly on mental health. Until recently that I put it on hold, and we are going to get back sometimes in January. And I think that is an introduction. I'm born again. I worship at Elijah Kagili PCA here in Thika. So I think it's good that I go to the topic on depression and suicide. Now, yeah, parenting, there's no school for parenting, and I can tell you, even now I'm still parenting, or glad parenting, and I'm learning every day. And so let's take heart. We are going to learn iron sharpens iron. So let's go to the topic: depression and suicide in family setting, or even a friend or a colleague who is affected, or even you as a person. This is a learning point. And we need to, I would like to share with you how you can support a family member or a friend if they're going through depression, or maybe somebody is contemplating suicide. As Telly have said, I remember the video that went viral about this mother whose son committed suicide. And I remember I shared it in so many forums. I got responses. And quite a number of people, people can comment anyhowly. And there are people who might feel the mother should have been more keen, or why commit suicide, all those kind of questions. But as I'm going to discuss, you realize that sometimes it is quite difficult for people who are going through depression and have suicidal ideation. Is usually a very difficult time. Again, I know of a case I saw on the Facebook sometimes back, I think it should be last year. And somebody just wrote on Facebook, he is tired. And he said, you are welcome for my funeral if my body is ever found. And I remember people commenting on Facebook and, Kenyans on Twitter and on social media. Kunywa rat. I have the rope. When is the funeral? There are, of course, some others who try to restore him, and they talked about be anxious for nothing. That by prayer supplication, make your request known unto God, which I think is true because it's a scripture and the word of God is forevermore settled in heaven. But on the other hand, you bear me witness, even those who believe in God, you and I, there are times we go through problems and God does not make sense. That does not mean that God does not make sense, but the way we perceive our surrounding, our life, and our difficulties, we might go to the point. James Dobson, who is a clinical psychologist and also a pastor, wrote a book, When God Does Not Make Sense. You can buy it and you have a look at, you read and understand. There are times we are so low, even born again do contemplate suicide at some point. So somebody maybe in his room, he doesn't know whom to talk to, he's so down, he's very low. Who can really understand me? And so for the introduction part of it, helping someone with depression can be a challenge. It's not easy because the energy is usually very low. If someone in your life has depression, you may feel helpless and wonder what to do. You have a friend, you have a family member, you have a colleague at work. Sometimes it can be very difficult and you might feel helpless and wonder, what do I do? What do I tell him? Where do I go with him? Where do I refer him? And you feel helpless. Before then, let's look at mental health in a general way. What is mental health? Mental health is defined as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her society. That is according to WHO 2014. Or we can also define it, the capacity to live a full life, productive life, as well as the flexibility to deal with its ups and downs. In children and young people, it is especially about the capacity to learn, enjoy friendship, to meet challenges, to develop talents and capabilities. We have 10 facts from the WHO, World Health Organization, facts about mental health. Now, mental, neurological, and substance use disorder make up 10% of the global burden of disease and 30% of non-fatal disease burden. Around 1 in 5 of our world's children and adolescents have mental disorders. Depression is one of the leading causes, underscore that. Depression is one of the leading causes of disability, affecting 264 million people in the world. About half of the mental health disorders begin before the age of 14. And therefore, as we do parenting, we need to be quite observant of our children. Almost 800,000 people, and I saw this, it had been put on the Facebook, on the where we have our poster, or where I was tagged by Terry. She quoted this one. Almost 800,000 people die by suicide every year. That means one person dies from suicide every 40 seconds. Suicide is the second leading cause of death in individuals between age 15 to 29. Another fact is allowed 1 in every 9 people in settings affected by conflict have moderate or severe mental disorder. People with severe mental disorders die 10 to 10 years earlier than the general population. And therefore, the need of us taking care of our mental health or taking care of the mental health of those that we love and we care about. The list of mental health workers vary from below 2 per 100,000 population in low-income countries to over 70 or per 100,000 in high-income countries. Less than half of the 139 countries that have mental health policies and the plans report having this aligned with the human rights conventions. The global economy loses about $1 trillion US per year in productivity due to depression and anxiety, and we belong to this international community. Now, the situation in Kenya, kindly my co-host Terry mute some of us who have not managed to mute, or if you're able to mute yourself, kindly do so. Situation analysis in Kenya. Kenya's mental health policy estimates that about 25% of our outpatients and about 40% of our inpatients suffer from mental health conditions. A review of the health ministry records by the Office of the Auditor General reveals that as of 2016, there were only 88 psychiatrists, most of them located in Nairobi. And that tells you the ratio is quite low. That would mean 1 into 5 million compared to the recommended by WHO 1 to 10. Psychology services in Kenya, one worker is faced with a ratio of 4.6 million patients instead of recommended 15,000. Though with the COVID-19, it has caused, I think the ministry to think about this. We have they have employed some psychologists. Of course, from 2016, this number of psychiatrists have gone up. As of last year, Kenya was later to be number 6 in Africa in cases of depression. That is sometimes last year around May, June. Common mental health illnesses are depression, anxiety, bipolar, schizophrenia, and other psychosis, dementia, developmental disorder, including autism, mood disorders, personality disorders, eating disorders, and substance abuse disorders. I may not be able to go into details of each of these, but I will look at depression itself. Depression. What is depression? Depression is classified as a mood disorder. It may be described as feelings of sadness, loss, or anger that interfere with person's everyday activity. People experience depression in different ways. It may interfere with your daily work, resulting in lost time and a lower productivity. It can also influence relationship and some chronic health conditions. That means depression affects you even to perform the very simple tasks. Even waking up in the morning, making your bed, making a simple meal. There is no energy to do things, to accomplish even the simplest thing. There are several possible causes of depression. They can range from biological to circumstantial. Common causes include family history. You are at a high risk for developing depression if you have a family history of depression or another mood disorder. Another cause can be early childhood trauma. Some events affect the way your body reacts to fear and stressful situations. For example, when you talk about the SGBV, sexual or rather sexual abuse or sexual violence or even gender-based violence, it can cause a problem when it is early, let's say early, what we call child sexual abuse. It can later on manifest in form of depression. Brain structure, there's a great risk for depression if the frontal lobe of your brain is less active. I may not go into detail about biology. However, scientists don't know if this happens before or after onset of depressive symptoms. There can also be medical conditions. Certain conditions may put you at high risk, such as chronic illness, insomnia, that is lack of sleep, chronic pain, or ADHD, attention deficit hyperactivity disorder, which we find it quite common with young people. Drug abuse, a history of drug or alcohol abuse or misuse can affect your risk. Other risk factors for depression include low self-esteem, personal history of mental illness, certain medications, stress events such as loss of a loved one, economic problems, or divorce and separation. There isn't a single test to diagnose depression. There are many tests, but your healthcare provider may make a diagnosis based on your symptoms and a psychological evaluation. In most cases, they will ask a series of questions about your moods, your appetite, your sleep pattern. We call them in our medical terms, we call appetite and sleep pattern, we call it vegetative functions. They may also try to look up about your energy, activity level, or your thoughts. Those are areas that can guide. But when you are being seen as a client, as a patient, they can still use international tools to assess that. We call, one of them, we call it the BDI, that we can fill some questionnaires there, and out of that we can calculate and see, well, how are you depressed, and if depressed, is it severe, is it moderate? How can you assist somebody who is going through depression, who is contemplating suicide? There are many things that you can do and learn the symptoms of the depression. That's why we are doing this tonight. Encourage treatment, that is, although I'm going to go through them issue one by one, and encourage treatment, identify warning signs of worsening depression, understand the suicide risk, stay alert for warning signs of suicide, and provide the support needed. Learn the symptoms of depression. Depression signs and symptoms may vary from person to person. They include feelings of sadness. Remember in definition, I talked about this. Tearfulness, emptiness, or a feeling of hopelessness. Some may present with angry outbursts, irritability, or frustration, even over small matters. Loss of interest or pressure in most or all normal activities, such as sex, for those who are adults, or who are married, or who are partners. And I know we are not limited. It depends on your faith. So we could be having people who are still, depending on your faith, and you're sexually active, but you realize that you have lowered the interest. Or even maybe you're married. There is lots of interest in home-based and sports. There is insomnia or sleeping too much. There can be tiredness and lack of energy. So even small tasks take extra effort, as I had said earlier. There can be changes in appetite, reduced appetite and weight loss, or increased cravings for food and weight gain. So you might find somebody who has gained a lot of weight and you are congratulating her. Oh my God, you look nice. You really, your weight, you have increased. Kumbe, this somebody is going through depression and is in the house, walking through the sitting room, he buys this, to the kitchen, buys that, to the fridge, buys that, and most likely is going through depression. Anxiety or agitated or restlessness. There can be slow thinking, speaking or body movement, feelings of worthlessness or guilt, fixation on past failures, or blaming yourself for things that aren't your responsibility, trouble thinking, concentrating, making decisions and remembering things, frequent or recurrent mention of death, suicidal thoughts, suicide attempts, or even suicide. There are some who have gone ahead and have died by suicide. Unexplained physical problems such as back pain, headaches, Harper-Napale syndrome, kind of. Please note, for many people with depression, symptoms usually are severe enough to cause noticeable problems in day-to-day activity, such as work, school, social activity, or relationships with others. Other people may feel generally miserable or unhappy without knowing why. Children and teens may show depression by being irritable or cranky rather than sad. Another thing, so number one is learning those signs and symptoms. That's why we are doing this today. When you know those signs and symptoms, then you will help from the point of understanding. The Bible says, my people perish because of lack of knowledge. And therefore, the knowledge and understanding those signs and symptoms are very key. Now, encourage treatment. When you see these signs and symptoms, it's important that you talk to this person, and if they are put on treatment, you encourage them to take. People with depression may not recognize or acknowledge that they are depressed. They may lack the insight. They may not be aware of signs and symptoms of depression, so they may think their feelings are normal. All too often, people feel ashamed about their depression and mistakenly believe they should be able to overcome it with willpower alone. But depression seldom gets better without treatment, and may get worse. So when you see those signs, it's good to encourage somebody to see a doctor or to see a healthcare provider. With the right treatment and approach, the person you care about can get better. Here's what you can do to help. Talk to this person about what you've noticed and why you are concerned, and with respect. Explain that depression is a medical condition, not a personal flaw or weakness, and that it usually gets better with the treatment. Suggest to this person, suggest seeking help from professional, a medical doctor or a mental health care provider, such as a counselor or a psychologist. Offer to help prepare a list of questions to discuss in an initial appointment with a doctor or a mental health care provider. Express your willingness to help by setting up appointments, going along to them, and attending family therapy sessions. Please note, if your loved one's illness is severe or potentially life-threatening, contact a doctor or a hospital, even over phone, and especially this time of COVID-19, the doctors are still seeing people on Zoom, on digital platforms, and unlike before, they are even prescribing. But of course, talk to the right doctors who are specialists on this area, and somebody can be done therapy online. And when we realize this one needs medication, we will refer as appropriate. Another thing is you need to identify the warning signs of worsening depression. Remember, we had talked about the signs and symptoms. Everyone experiences depression differently. Observe your loved one. Be keen. Learn from how depression affects your family member or a friend, and learn what to do when it gets worse. Consider these questions. What are the typical signs and symptoms of depression in your relative or a friend? Remember, we have just discussed them, and I guess I'll be able to see how you get the notes. What behaviors or language do you observe when depression is worse? And again, I think Tele is recording, can give the Google Drive, the link to this Google Drive. So what behaviors or language do you observe when he or she is doing well? What circumstances trigger episodes of more severe depression? What activities are most helpful when depression is worse? These are questions you can consider. Worsening depression needs to be treated as soon as possible. Encourage your loved one to work with his or her doctor or mental health provider to come up with a plan for what to do when signs and symptoms reach a certain point. Somebody is raising her hand. Maybe I'm lost. Am I still there?
Yes, you're still.
I'm still there.
Yes, you're still here. Ruth, maybe you can type your question or comment on the chat. You can message me directly. Yeah, thanks.
Yeah. Okay. Yeah. So, as part of this plan, your loved one may need to contact the doctor to see about adjusting, changing medication. Remember, we have just talked about they have been put on medication and you are encouraging them to take their medication. But there could be need, if there's still the signs are there, need to adjust the medication. So it's good to contact the doctor. It's also good to see a psychotherapist, such as licensed counselor or a psychologist. And please note, this is where we have a challenge. In fact, today I was dealing with somebody, whereby doctors put a patient on medication, and when they start feeling better, they stop taking medication. There is no counselor or psychologist who can stop your medication. Your medication needs to be stopped by a doctor, and where possible, by a psychiatrist. Take self-care steps such as being sure to eat healthy. For you, you who is assisting, it's important to take care of yourself so that you don't. Remember, we talked to the first slide. You might be feeling helpless, so take care of yourself as well. Are there complications with the depression? Yes, there are. If left untreated, complications can include weight gain or loss, physical pain, substance use problems, panic attacks, relationship problems, social isolation, thoughts of suicide, and there can also be self-harm. Self-harm is whereby we have, especially young people, cutting themselves. to see, and they say they feel good when they see the blood flow down. Management for depression, there can be medication and there can be psychotherapy. And at psychotherapy, there are many techniques that can be used, which we may not go into detail. The psychologist who is seeing the person, the counselor who is seeing the person, will be able to do what need to be done. Suicide. That is a lope, and if somebody is like feeling if I'm able to hang my.
So
Hello?
can we pause? Is there a question that anybody might want to ask about depression?
Okay.
Or would you rather you finish and then?
There are a few slides we can finish, then we look at the questions.
Okay, go
okay,
ahead.
Suicide. Because they go along. What is suicide as suicidal behavior? Suicide is the act of taking one's own life. Suicide behavior refers to talking about or taking action related to ending one's life, self-life. Suicidal thoughts and behaviors should be considered a psychiatric emergency. When I'm seeing a client who has a mental health problem and I hear about suicide, I know counseling is key, but also it's a psychiatric emergency. Most of the time, these patients are not left to go home, depending if somebody had even had a plan of action and had even attempted. Most of the times the doctors do admit and put the patient on antidepressant or rather on medication as appropriate. Understand suicide. It's also another way of helping these clients that we're having or these relatives. People with depression are at an increased risk of suicide. If your loved one is severely depressed, prepare yourself for possibility that at some point he or she may feel suicidal. Take all signs of suicide behavior seriously and act immediately. Take action if necessary, like talk to the person about your concern. Ask if he or she has been thinking about attempting suicide or has a plan for how to do it. Having an actual plan indicates a higher likelihood of attempting suicide. Another thing you can do, an action point, seek help. Contact the person's doctor, mental health care provider, or other healthcare professional. Let other family members or close friends know what's going on. Because of stigma and discrimination, some people might decide, let us not tell people in the family. How will our cousins take us? How will the big brother take us? But note, it is important that we let other family members know about it, but of course, respectively. Make sure the person is in a safe environment, that is, if possible, eliminate things that could be used to attempt suicide. For example, I don't know, to be ignorant, I don't know whom I'm addressing. There are some of us who are licensed to have firearms. And you have noticed your son is suicidal. Let's make sure the firearm is somewhere that is out of reach. Any other medications you had tell it to call the pills that were there. When you notice somebody is suicidal, you know, all of us, we have become victims of this. So we are, you know, when we are put on medication, antibiotic for 7 days, most of us don't finish. You go for the third day, you are feeling better. You have kept them in your bedroom. Then Panados. Then I don't know what. When somebody is suicidal, we'll collect all that. If you are having agrochemical products, you are doing some farming here and there, and you have a suicidal person, this can be a very unsafe environment. Make sure you remove, like for me, behind here, I have some rooms with some ropes for, of course, some certain things. And if I realize one of my relatives staying with me is suicidal, I think one of the things is to lock that room. I hope I'm communicating. Stay alert. Another thing you can do, be alert. Stay alert for warning signs of suicide. Learn and stay alert for common warning signs of suicide or suicidal thoughts. For example, talking about suicide, making statements such as, I'm going to kill myself, I wish I were dead, or I wish I hadn't been born. Be keen on those statements. Getting the meaning to attempt suicide, such as buying a gun or stock peeling pills. And I'm saying this because I've worked with the clients, and I've had one say, if I get a gun, and in psychology we say there's no slip of tongue, so be sensitive on this. Withdrawing from social contact and wanting to be left alone, having a mood swing such as being emotionally high one day and deeply discouraged the next, being preoccupied with death, dying, or violence, feeling trapped or hopelessness about a situation. Remember, it's not only about your relative. Even ourselves, we can diagnose ourselves. Increased use of alcohol or drugs, changing normal routine, including eating or sleeping habit, doing risky or self-destructive things such as using drugs or driving recklessly. There are people who have driven themselves and they cause self-harm by, just driving into another vehicle. But when you look back, you realize this person has been talking about suicide, giving away belongings or getting affairs in order when there's no other logical explanation for why this is being done, saying goodbye to people as if they won't be seen again, developing personality changes, or being severely anxious or agitated, particularly when experiencing some of the warning signs listed above. How can you help this person? You need to provide support. Remember that your loved one's depression isn't anyone's fault. You can't fix the person's depression, but your support and understanding can help. What you can do for your loved one: encourage sticking with the treatment. I had mentioned earlier, let your relative take the treatment. Be careful and check whether he's taking treatment, because you might be thinking they are taking, but they are not taking their treatment. If your relative or friend is in treatment for depression, help him or her remember to take the prescribed medication and to keep appointments. Again, be willing to listen. Let your loved one know that you want to understand how he or she is feeling. When the person wants to talk, listen carefully, but avoid giving advice or opinions or making judgment. Just listening and being understanding can be a powerful healing tool. Again, you can give positive reinforcement. How do you do this? People with depression may judge themselves harshly and find fault with everything they do. Remind your loved one about his or her positive qualities and how much the person means to you and to the others. Another thing in providing support for somebody who is suicidal: offer assistance. Your relative or friend may not be able to take care of certain tasks as well. Remember, we said depression makes somebody lose energy, even performing simple tasks. Give suggestions about specific tasks you'd be willing to do, or ask if there's particular task that you could take for them. Again, you can help create a low stress environment. Create a regular routine. Creating a regular routine may help a person with depression feel more in control. Offer to make a schedule for meals, medication, physical activity, and sleep, and help organize household chores. By the way, when you have a schedule for these people, you encourage them, and we do that even in psychotherapy. When they have written something what they want to achieve by the close of day, they feel some energy in themselves and they feel better. Another thing, locate helpful organization. For our situation in Kenya, we have the Befrienders. There are many others if you go to the internet, and there are more. Befrienders are concerned about people who are depressed or even who are suicidal. Again, by providing support and encourage participation in spiritual practice if appropriate. I'm saying this because, again, we have different, our members of the family could be very, very different in the way what they believe in. But encourage participation in spiritual practice if appropriate. For many people, faith is an important element in recovery from depression, whether it's involvement in an organized religious community or personal spiritual beliefs and practices. Again, make plans together. Ask your loved one to join you on a walk. And when you walk when there's sunshine, sunshine provides us with vitamin D, which also helps to relieve the depression and the stress. See a movie together. When you have some laughter, the body produces a feel-good hormone. Or work with you on a hobby or an activity he or she previously enjoyed. But don't try to force the person into doing something. What you can do for yourself as a caretaker: learn about depression, which we have just done. The better you understand what causes depression, how it affects people, and how it can be treated, the better you'll be able to talk to and help the person you care about. Number 2, take care of yourself. Supporting someone with depression is not easy. Ask other relatives or friends to help, and take steps to prevent becoming frustrated or have a burnout or something we call compassion fatigue. Find your own time for hobbies, physical activity, friends, and spiritual renewal. Finally, be patient. Depression symptoms do improve with the treatment, but it can take time. Finding the best treatment may require trying more than one type of medication or treatment approach. So be patient with the psychiatrist who are seeing your relative or your friend. Be patient with the people who are doing psychotherapy, because it's not just you are given an injection and the energy comes back. For some people, symptoms quickly improve after starting treatment. For others, it will take longer. So it's important that you do take care of yourself. Having said that, thank you so much for listening, and have a great evening.